This video is on your primary survey, your initial assessment. First step is your general impression. You want to get gender, age, and weight. You're going to use two acronyms. You're going to use FSDO, which is facial expressions, eye contact, dress, grooming, and hygiene, speak when approached, and odors. The next one you'll use is WARF, which is words per sentence, abnormal sounds and positioning, retraction, and nasal flaring. Next, you'll do what's called your patriotic patient, and that's where their skin is either red, white, or blue. If they're red, it's fever, sunburn, anything like that. White could be will be shock and anemia, and blue it means they're cyanotic. And then you're going to determine if your patient is sick or not sick. Then you'll go into level of consciousness, which you can do with AFPU, which is alert, verbal, and painful, or unconscious. Or you can do alert and oriented times for person, place, time, and event. Then you're going to determine the chief complaint and life threats. Who called? Why they called? Did you call? Did somebody call for you? And you're going to treat any life threats that need to be treated. Then you're going to get into your ABCs. So you're going to do airway and breathing first. So you're going to assess the airway. And when you assess the airway, if you need to open it, you need to keep it open. Once you've opened it, you need to do an adjunct or something to keep it open. If they're breathing, you need to see if it's too fast or if it's too slow, what kind of noises do they make, what their lung sounds. You also need to look, listen, and feel. You need to put your ear down there and listen. You need to put your hands on their chest to see if the chest rises and falls. And you just need to administer oxygen therapy if needed. Then you can get into circulation. You'll check for any major bleeding, which you should have already checked and taken care of major bleeding because that is a life threat. You're going to check their skin color, condition, and temp. If, they're cold, clammy, they're diaphoretic. And if you're going to check their skin temperature, you put your palm of your, back of your wrist on them to check because your hands might be cold. You also need to assess for a pulse. If you can't find a radial pulse, you need to check for a carotid pulse. Then you're going to check for pearl, and you're going to check for pupils equal, round, and reactive to light, and they accommodate. And then you're going to expose anything that needs to be examined. And then you're going to identify if that patient is a stay and play patient, which is not critical, and if they're load and go, which means they are critical.